Good afternoon, everybody, and welcome to the latest in the Candela webinar series. This afternoon, we have Dr. Firas Al-Niemi, who's going to be discussing some frequently asked questions with regards to a number of our Candela machines. Dr. Firas is a consultant dermatologist who's based in London. He has a great many years of experience in using lasers, and in addition has published multiple clinical papers. Just before I hand over to Firas for him to start his presentation, there's just a couple of housekeeping things we need to go through. First of all, when you look at your screen, at the bottom, you'll see there's a multiple application engagement tool that you can use. And if you look at these different icons along the bottom of the screen, it's possible for you to move them or change the size of them. So feel free to move them around so you get the most out of your desktop space, so you can see the full screen for the presentation. It's also possible to expand the slide area or maximize it to full screen by clicking on the arrows in the top right-hand corner. If you do have any questions during this webcast, you can submit them through the Q&A engagement tool, and this should be sitting at the bottom of the screen. We will try to answer these during the webcast, but if you need a fuller answer or we run out of time, we will answer the questions for you via email. And we do capture all of the questions, so your question will not be lost. On the left-hand side of the screen also, you will see a list of resources which relates to this webinar. And we encourage you to download any of these resources or links that you might find useful. For the best viewing, we recommend using a wired internet connection and closing any other programs or browsers running in the background, as this can cause issues. And remember, webinars are bandwidth intensive, so closing any of these unnecessary browsers will conserve your bandwidth and stop the screen slowing down or going very jerky. The webcast is being streamed through your computer or your internet connection, so there is no dial-in number. And for the best audio quality, please make sure your computer speakers or your headset are turned on and the volume is high enough so you can hear the presentation. Some of the networks can cause slides to advance more slowly than others, so logging off your VPN is recommended. And for desktop users, if you do find that the slides are behind, pressing F5 on the keyboard will refresh the page, and therefore you'll catch up with the slides. And finally, a recording of this webinar will be shared with all the registrants approximately 1 day after the event. So that's my housekeeping done, and I will now hand over to Firas. Thank you, Firas.
Thank you, Hamish, for the kind introduction. Good afternoon, dear colleagues, if you are based in the UK, and good evening if you are in continental Europe and beyond. This webinar is different from the previous webinars because we are not going to be discussing one particular system, but what we are going to do is try and address some of the frequently asked questions. As Hamish mentioned, these are questions that have been posed during conferences or from experienced users like most of you. So the aim of this webinar is really to take you through the key 4 products that I'm using: the V-Beam Prima, the Gentle Max Pro, the Core, as well as the PicoWay, and we'll try and address 2 frequently asked questions from each system. And at the end of the webinar, please do submit your questions, even if they are not particularly related to what I have been discussing, but as long as it relates to one of these 4 devices, we will endeavor to answer the questions. So the first system that I would like to discuss will be the Gentle Max Pro, and we have 2 questions that I would like to address. The first one is, can we treat all skin types with the Gentle Max Pro? And I think this is a very important question because the demographics in most of the countries is now changing. where due to immigration and due to interracial marriages, we are having patients with all different skin types, including skin type 5 and 6, which they also desire to have laser hair removal. So we will answer that question. And the second question is also a very important one is, although we often refer to these lasers as long pulse lasers, as in we use them in the millisecond range, but in the Gentle Max Pro, we are able to go into the sub-millisecond domain where we can use a microsecond pulse. And some colleagues have asked what the importance or significance or the clinical use of the microsecond pulse is. So we will address these. So the first question really is, we have 6 Fitzpatrick skin types, 1 to 6, and the question is, can we treat all these skin types with the Gentle Max Pro system? Well, the simple and straightforward answer that you need to know is yes, but we'll try and explain why that is the case. Now, let's just go back to the history. In 1996, the first laser hair removal was launched, and that was with the Ruby laser, with the 694 nanometer. So for the historians amongst yourselves, the first ever laser hair device that was used, and there are still some functioning Ruby lasers around, was a 694 nanometer laser. Now that has largely been replaced now by the more specific laser hair removal wavelength, which is the 755 nanometer. As we know from the physics, the absorption coefficients of melanin is higher the shorter the wavelength. So the shorter the wavelength, the more increased absorption of the melanin, which would mean that the efficacy for laser hair removal will be better, because the target with laser hair removal is the follicular melanin unit. So that is the melanin unit that wraps around the hair shaft. And there is also a degree of absorption by the hair shaft. But the other important physical phenomenon that we know is that the longer the wavelength, the deeper the penetration. That meant that in clinical practice, even though the 694 nanometer was strongly absorbed by melanin and therefore would be very efficient for laser hair removal, it was still being highly absorbed by the epidermis, because that's where most of the melanin is. And as a result, in skin types 3, for example, there were cases of crusting and blistering and epidermal dyspigmentation. So that is when the wavelength for laser hair removal was shifted to the 755 nanometer, which is the alexandrite. And as a result, there was a better compromise where still there is very high absorption of melanin to the wavelength of 755 nanometer, so still very efficient in terms of hair removal. But that extra depth of penetration meant that there was an increased safety and less risk on the epidermis. So for the skin types 1, 2, and 3, the 755 nanometer is an excellent choice of wavelength because it's highly absorbed by melanin and it still penetrates deep enough that it's safe on the epidermis. Now, the question that is often posed is not so much the 755, because most users appreciate and understand that the 755 is the best wavelength for the lighter skin types. But the frequently asked question is, what about the diode? Now, if you look at the absorption coefficient for melanin, it is true that the diode is more absorbed by melanin. That is true. But let's look at the evidence as well. Many of the papers regarding laser hair removal were published many, many years ago. That is because, as I said, in 1996, we had the first laser hair removal system with the Ruby laser, and then years afterwards, there were all the developments in terms of laser hair removal. But we pretty much know now how it works. This is one of the key first papers that looked at the comparison of the 3 different wavelengths and the efficacy, and it was established that the alexandrite was the best one. And yes, whilst you may think that the diode is also highly absorbed in comparison to the Nd:YAG, But when you look at the very dark skin types, and when you look at particularly the skin type 5 and skin type 6, and you can see this in another review article that was published in Dermatologic Surgery, the Nd:YAG 1064 was the most suitable. So we have a scenario that if you have a Gentle Max Pro, with the Alexandrite 755, it will be absolutely perfect to use it on the skin types 1, 2, and 3, and for some experienced users in skin type 4. But then if you have the Nd:YAG 1064, then you can safely treat up to skin type 6. So where the diode is going to be different is that you can use a diode on a skin type 4, and possibly in some cases of skin type 5, but the diode cannot be used on a skin type 6. And trust me, in many of the countries, there's a growing population of the skin type 6 that also requires laser hair removal, and therefore the Nd:YAG will going to be the most suitable. But that's not the whole story. So it is not just the comparison between an Nd:YAG and a diode in terms of the skin types 5 and 6. The other important phenomenon is, as we treat with laser hair removal, what happens actually is that the hair shaft becomes finer, which means that the follicular melanin unit, which you can see that wraps around the hair shaft, becomes smaller too. This is what we see. We start with a thick hair, and after a few sessions with laser hair removal, the hair density decreases, but the thickness of the individual hair shaft becomes thinner too. And it's back to the thermal relaxation time principle, that when you have a large object, you have a longer thermal relaxation time, which means long pulse. But when you have a smaller target, then you have a shorter thermal relaxation time. So when the hairs become finer as you progress with treatment, then the follicular melanin unit of that particular fine hair will become short too. And you then need to drop the pulse duration to use a short pulse duration. And this is exactly the strength of the Gentle Max Pro, is that you have the ability to go to a very short pulse duration, as short as the 3 millisecond for the hair removal, which is particularly good and useful for the fine hairs. This is something that some of the systems, including the diode systems, are unable to do so. So they simply do not have the power and the ability to get into a very short pulse duration to adequately treat fine hairs, and most commonly, for example, on the face. So whilst you may start with the first couple of treatments and you will see the results, but as the hairs become finer and at the later, at more advanced stages of the hair removal, you need to drop the pulse duration. So what skin types can the Gentle Max Pro treat? Well, the Gentle Max Pro can treat all skin types. That is the Alexandrite 1 to 3 and the Nd:YAG 4 up to 6, including the 6. And the other advantage is, as the hairs become finer, we are able to treat those because we can use a very short pulse duration. So that is an important question that's been answered. Now, the next question is the microsecond pulse. So if you have the Gentle Max Pro, you can, with a certain handpieces, you are able to go below 1 millisecond. So when we go below 1 millisecond, we will call that sub-millisecond. But remember, the sub-millisecond can also include the microsecond or the nanosecond. So any pulse duration that is below 1 millisecond, by definition, is sub-millisecond. But what we mean here is a microsecond. So that is a pulse duration that is longer than the nanosecond, but shorter than a millisecond. So it's between the nano and the millisecond. And that is the pulse duration that we will call the microsecond pulse. Okay, so if you have the microsecond pulse with the 755 nanometer, with the smaller spot sizes, you are able to go below 1 millisecond in the microsecond. Then that can be very close to the nanosecond. So this is why you can use that for benign pigmentation. So remember, when we were using the 3 millisecond on a large spot size, when we were doing the field treatment for the chest or the back of the hands, That was because on a 15 millimeter or an 18 millimeter spot, the shortest pulse duration that you could get with this wavelength was a 3 millisecond. So it's short, as close as to the nano as possible, because the thermal relaxation time of melanin is short. But if you then go into the microsecond domain, with the smaller spot sizes, you can treat pigmentation more efficiently. But most of the uses is with the 1064, because the 1064 Nd:YAG, this is the wavelength that is absorbed by all three main endogenous chromophores. It's absorbed by melanin, hence we use it for hair removal. It's absorbed by blood, by hemoglobin. This is why we use it for vascular indications. And it is also absorbed by water, which is found predominantly in the dermis. 60 to 70% of the composition of the dermis is water-based. So when we are using the Nd:YAG in a microsecond pulse duration, the pulse duration is very short. It is so short that it does not lead to heating up of the epidermis to the degree that it's likely to give us crusting or blistering. But what it does, it slowly builds up the heat within the dermis, because that microsecond pulse duration, when it's used in high frequency, so in a high hertz, 6 hertz or higher, what is happening is that this wavelength is being absorbed by the water in the dermis, and as a result of that biological interaction, as a result of the absorption, it is generating heat. So the temperature within the dermis is going to increase. There is also an absorption by the very, very fine small blood vessels within the dermis. So this is why we get the clinical improvements in terms of coagulation for diffuse erythema, or we can use that in where heat matters, such as, for example, in conditions like inflammatory acne, onychomycosis, or tightening. So these are the conditions that you can use the Nd:YAG in the microsecond domain. So diffuse redness and rosacea. If you don't have the V-beam Prima, this is what you can use. And you have the Gentle Max Pro. Acne, tightening, flat scars, and onychomycosis too. Whilst it's difficult to give exact settings and parameters because there are few variables that are important in this case, but as a general rule, it is a large spot size, so somewhere between 8 to 12 millimeter spots. And then it's the microsecond, which is the 300 microsecond pulse duration. And as I said, when we are using it with a higher frequency, you accumulate the heat. So what happens if you are very, very slow is that you are never going to reach a desired temperature within the dermis, because any heat that you generate is just going to be cooled down. Whereas when you're using a higher frequency, you are fast, you are very fast in accumulating the heat, and this is why you get the bulk heating. And this is why we don't need the cooling on the surface, because there is not much overheating of the epidermis, because the pulse duration is so short, it is not being very absorbed highly by the epidermis, leading to increased temperature there. And you know, years ago, there was a study that was published by the Koreans and the Japanese in Asia using the Gentle YAG. So again, they used the 8 millimeter spots with the 300 microseconds, with a fluence of 13 joule, 7 hertz, with no DCD, painting motion, and they used that for rejuvenation. This particular study was a very nice study because they did 4 weekly intervals, a total of 5 treatments, and then 3 weeks after the final treatment, they took biopsies as well, and they did staining for collagen, and they found that there was more collagen and better improvement. So it's a nice study. It's a nice treatment that you can do. If you do have the Gentle Max Pro, please use the microseconds for diffuse erythema, inflammatory acne, tightening, and you can combine that with other treatment modalities too. Now we're going to move over to the PicoWay with 2 clear questions. Question 1, what colors of tattoo ink can we remove? And the second question is, how does the PicoWay resolve handpiece, that is the fractional handpiece of the PicoWay, can improve or reduce on acne scars? So if we talk about the tattoos and the colors, the first thing to do is just familiarize yourself with the color wheel. This is bringing you back to your physics lessons. And if you just type in, you'll be able to get this color wheel on Google, just type in color wheel. And then let me just refresh your memories. We know that each color has a complementary color that it absorbs. And it's the opposite color in the color wheel. So if we look at red, the opposite color in the color wheel is green, which means green is the complementary color for red. And this is why we use the 532 for red tattoos, because when you have a red ink in a red tattoo, then you will need the complementary color that it will absorb, which is the green color. So as you know, the green is 532. And then the opposite is true. And this is why we have the 730 and the 785 for the range of the green and the blue tattoos. So in the Pico Wave, we have 4 wavelengths. The 532 nanometer is what we can use for red, orange, yellow, purple colors. The 785 and the 730, so that is now we are in the red area, so it will treat all the colors opposite to that. So you can see it's the light green or the green with the yellow and the green with the blue shift. And the 1064 can treat the black color tattoos because black absorbs all wavelengths. So whilst it is correct that any wavelength can be used for black tattoos, but remember, all these other wavelengths are shorter wavelengths compared to the 1064. Therefore, the melanin absorption will be higher. So there will always be a degree of absorption and wastage of that fluence by the epidermis. So the advantage of having the 1064 nanometer is depth of penetration, but also less absorption by the melanin, and therefore less fluence is going to be wasted, and more of that fluence is going to be targeting the tattoo. We know now, there are several studies published, and we know that the commonest ink tattoo color is black, which means that investing in a machine for tattoo removal, you really need to have a strong 1064 nanometer wavelength. That is your strength. So I know that some are keen on some other wavelengths, but really for tattoo removal, since the vast majority of the tattoos are black tattoos, the 1064 we're going to have a short pulse duration with a high power. In summary, we can treat all different colors, with the exception of white color, because white, there is no single wavelength that will treat white color tattoos. But all the other colors can be treated with the Pico Wave, and that is because we have the 532 for the likes of the red tattoos. We have the 730 and 785 for the green and the blues, and we have the 1064 for the black tattoos. What you see here on the image is basically the tattoo ink. This is a biopsy, and you can see the level of the depth of the tattoo ink, and this is why the 1064 is particularly good for this black ink, because it can reach it without losing that fluence through the absorption by the epidermis. The other question is, how does the Resolve handpiece work with acne scars? And I think this is a very important and good question. And the reason why this is, I find, a very good question is because prior to the fractional handpiece of the Pico Wave, we were used to the fractional ablative and the fractional non-ablative, where we had this linear association with the depth of penetration as the fluence increases. So we were trained to think depth of a scar using a wavelength and a fluence that is going to get to the depth of that scar. Whereas with the Resolve fractional handpiece, the fractional picosecond technology relies on a different mechanism of injury. It is not solely related to the depth, because it is related to a shockwave effect in a 3D dimension. So in a 3-dimension shockwave vibrations. But what happens is, you get light-induced optical breakdown, which you can see them as these bubbles and vacuoles in the epidermis. We call them light-induced optical breakdown. And in the dermis, with the longer wavelengths, such as the 1064, we get these cavitational effects in the dermis that we call the LICs. So in the epidermis, we get these vacuoles and these bubbles, which we call the light-induced optical breakdown, the LIOBs. And in the dermis, we are getting these cavitational effects that we call the LICs. And what they do is they do the 3 Cs. The first C for cell signaling, the second C for cytokine release, and the third C is collagen deposition. So basically, with the fractional handpiece of the pico, we are getting a shockwave-based injury that gives us an injury in the epidermis in the form of LIOBs, an injury in the dermis in the form of LICs, that kickstarts a wound healing process through cell signaling and cytokine release, ultimately giving us better collagen deposition. So it's a microscopic injury that promotes wound healing, but it's a different concept from the fractional ablative of getting to the base of the scar and generating a thermal wounding there. Just think of a blast that you have in the skin and the shock waves that travel in a 3D dimension, kickstarting a wound healing process. It's a very elegant way of wounding the skin. Now, this is my paper that I'm particularly proud about, and this is in collaboration with my Russian colleagues. And this is the only paper that is now published in the literature looking at 2 different fluences with the fractional pico handpiece. There are several published papers with different fractional picosecond handpieces looking at the effect of fractional handpiece on the tissue. But this paper is the only paper that looks at the differentiation between low energy versus high energy histologically. So in this study, we used the 1064 fractional picosecond, the resolved picoway, in 2 different fluences, in the low fluence and the high fluence. So what were the findings? And what you can see, and you can nicely, beautifully see these vacuoles and the LIOBs, and it's instant that you can see, even with the high fluence, there was no disruption to the basement membrane or stratum corneum. No disruption, damage to the basement membrane implies that there's going to be no risk of post-inflammatory hyperpigmentation or damage. But you can see that the LIOBs are larger and more numerous with the higher fluence. And you can see that again. So in the upper parts with the low fluence, when we were using the 1.1, there were few LIOBs. But look at the difference with the higher fluence. The LIOBs are larger and more numerous. So more tissue response. And then when we look at the pro-collagen type 3 staining, you can see a significant increase in the pro-collagen type 3 staining with a higher fluence. Remember the 3 Cs: cell signaling, so that is the cells communicating with each other after a blast injury. Then they release cytokines, messengers to start the wound healing process. Ultimately, the final C is the collagen deposition. So the take-home message is, with the higher fluence, we are getting more collagen deposition. So with the higher fluences, we're getting more LIOBs, more LICs, and we're getting better results when it comes to collagen remodeling, so particularly with acne scars. But this is the mechanism of injury. It does not relate to the depth as we see it or understand it with the fractional ablative laser. Now, this brings me over now to the fractional ablative, so the core. And again, two questions. Can we treat dark skin types with the core? And when we are treating in combination with the V-beam, can you combine that, or do you do that separately? Because again, this is something that I do a lot. And with the management of scars, we know that the combination of the pulse dye laser and the carbon dioxide works very well. So really, when it comes to the darker skin types, The main risk is post-inflammatory hyperpigmentation. So the behavior is predominantly with post-inflammatory hyperpigmentation with all thermal-induced lasers, with all lasers that generate heat. As we know, the darker skin types, the higher skin types are more likely to develop post-inflammatory hyperpigmentation. And this is particularly the case with the fractional CO2. But that doesn't mean we cannot treat darker skin types, and I treat dark skin types with the fractional CO2. The approach is just different, where I tend to prepare the skin with tyrosinase inhibitors, ideally 2 tyrosinase inhibitors, 2 of different types. Now, depending on where you live, you will have certain tyrosinase inhibitors. That could be kojic acid, arbutin, thiamidol, and with strict sun protection. I like to condition them for at least 4 to 6 weeks if they are at high risk of developing post-inflammatory hyperpigmentation. So that is putting them on the combination of the tyrosine kinase inhibitors and strict sun protection for 4 to 6 weeks prior to using the fractional CO2. This decreases the risk of developing post-inflammatory hyperpigmentation. The other thing is you can limit the modes into deep modes, because the mid mode with a higher density is more likely to give post-inflammatory hyperpigmentation. No surprise, because with the mid mode, remember, with the mid mode, most of your insult is epidermal, and therefore there's more epidermal injury, more epidermal exfoliation, and more epidermal inflammation and stimulation of the melanin production. Whereas with the deep modes, the density is lower and the injury is predominantly in the dermis. There is, of course, ablation of the epidermis, but in comparison to the mid mode, that is much less. Therefore, using the deep mode alone, so that could be, for example, if you have a dark skin type with acne scar, that you choose the shape and the deep modes to treat individual scars, and then use the larger scanner size and then treat the entire cheek. But you can just limit it to the deep mode. That will decrease the chance of post-inflammatory hyperpigmentation compared to using the mid mode as well. Other things is control the erythema and the inflammation afterwards. So cooling the skin afterwards also helps to decrease that risk. And you can use topical steroids for a few days. 2 to 4 days of using a potent topical steroid can also decrease the risk of post-inflammatory hyperpigmentation. What is particularly important about the core that not many necessarily appreciate in comparison to some of the other CO2 lasers is the random pattern sequencing. And that is that the spots in the deep mode in this case, for example, but also in the mid mode, are allocated randomly, which allows enough time for that particular tissue that had the fractional spot to cool down, rather than the linear sequencing where the dots are laid one next to the other, where you could potentially get a buildup of heat, and this again increases the risk of post-inflammatory hyperpigmentation. So we'll see if this video is working. It does not, but what you would have seen here is the random sequencing, where one spot is being laid and the other spot will be laid further away from it to allow for enough cooling time in between. And you know, if you live in London, it's the most cosmopolitan city in the world, and we have all skin types. This is one of my patients with nodular sarcoid, skin type 6. She had multiple systemic therapy, but she still was bothered by the nodular component of the sarcoid. And I published on this as well. So this is where you can limit to use the classic modes for the individual lesions, and then series of the fractional deep mode. And if you precondition the skin, that can work well and decrease the risk of post-inflammatory hyperpigmentation. Another case, this is trichoepitheliomas. We have done the largest series of trichoepitheliomas, a lot of experience. And again, classic mode on a small spot, ablate the individual lesions, and then just limit it to the deep mode, 1 or 2 passes, pre treat for 4 weeks. Some colleagues ask, when would you restart the lightening creams? I'll keep it very simple. It's the rule of 4 weeks, 4 weeks before, 4 weeks after. So 4 weeks before the CO2, start with the lightening creams. And then 4 weeks after the CO2, you can restart. The reason why 4 weeks, because you have the downtime and the reepithelialization that will take a week. And then for the first few weeks, the skin, the epidermis is thin, the skin is still a bit hyperemic and red and sensitive, and many of these lightening creams may cause irritation. So it's best to wait for a minimum 4 weeks to strengthen the epidermis, decrease some of that erythema, where patients will be able to tolerate these lightening agents. It's not a must, but that will be particularly useful for those individuals who are at very high risk of post-inflammatory hyperpigmentation. Otherwise, you can just continue with the sun protection as soon as they have reepithelialized, which is usually a week after the downtime. So what about the combination of core and V-beam for scars? I do this a lot, and it works very well, particularly effective for the hypertrophic or erythematous scars. So the way to do it is to do V-beam first. So you will do the V-beam first, followed by the core, not the other way around. So it's always V-beam first, followed by core. At any time you're combining a non-ablative with an ablative system, you start with the non-ablative first and you finish off with the ablative. For thick hypertrophic scars, and I have presented on this several times, purpura is a desirable endpoint that suppresses the connective tissue growth factor, and it gives us better results. And then in terms of the deep modes, many colleagues will ask what fluents, what settings will I use? The good thing about the core is that there are histology studies with regards to the depth of penetration with the deep mode, and roughly 10 millijoule will equate to 100 micron depth. You want to get to at least 50% of the depth of the scar, if not more. So if you have a scar that you think it's 600 micron deep, then you can use a 60 millijoule fluence, because 60 millijoules times times 10 will give you 600 micron depth. So you can calculate, as long as you know that for each 100 micron depth, you need 10 millijoule. And again, I have been involved in several articles using the CO2 as well as the vascular laser in combination for hypertrophic scars and keloids. These are two of my articles in that field. And the exact combination of the pulse dye laser and the V-beam Prima and the V-beam in the same session, so that is doing the V-beam followed immediately by the fractional CO2, has been published. This is in Lasers and Medical Science by our colleagues in Israel. So I know that there are colleagues who would like to start first with the pulse dye laser and at a later date introduce the fractional CO2, whereas I do it in the same session. And if you would want to know more about the publications with regards to using them together in the same session, I would recommend you get this article. So again, some examples of my patients. So this is hypertrophic scars, so V-beam in a purpuric setting, followed by fractional CO2 deep mode. Same here, purpura with the V-beam first, then deep mode, fractional CO2, same here. And then lastly, we are going to talk about one of my favorite devices, the V-beam Prima. Two key questions. There are several vascular platforms around in the market. Why is the V-beam Prima a perfect vascular platform? That's the first question. And the second question is, why can the V-beam Prima treat port wine stains in particular effectively, and more so, I would say, compared to many other vascular systems around? Now, with regards to the first question, it's important to again understand the basics of the physics, that as the wavelength increases, the depth of penetration increases too, which means that at the 595 nanometer wavelength, which is the pulse dye laser wavelength of the V-beam Prima, we are having a good balance between depth of penetration for these superficial vessels and less epidermal absorption. So there is enhanced efficacy and increased safety. As you go with a shorter wavelength, then you're going to have to compensate by using a larger spot size to get to that depth. But then you're compromising because in the higher skin types, there is the risk of more epidermal injury because the 532 is more absorbed by melanin compared to the 595. But on the other hand, when you have a very deep object, very deep targets such as a vein, a leg vein, or a venous malformation, then you want a wavelength that will penetrate that depth. And therefore, having the 1064 is particularly useful. So the V-beam Prima has the advantage of having two wavelengths, the 595 particularly good for the superficial vessels, but safer on the epidermis compared to the shorter wavelength, and the 1064 particularly good for the deeper vessels. And it's important to take into consideration that the 595 that we have has been an evolution since the first selective photothermolysis theory was published in 1983. Because if you look back at 1988, Candela's first vascular wavelength was the 577. And indeed, there are some systems around with a 577. But the reason why this was shifted later on to 585, and then in 1996, Candela gave the consumer 4 different wavelengths to study and to choose from. And the reason why in the year 2000, the 595 nanometer was chosen is exactly as what I explained. It's a good compromise between depth of penetration, what you want, because you want to get good depth of penetration to be able to coagulate vessels and reach your target, and less epidermal absorption, and therefore we can safely use it in skin type 3 and 4, for example. So why 595? Better penetration and efficiency, and I will add to that enhanced safety profile as well. We also have 2 cooling methods. So the DCD is particularly good when you're doing fast treatments in areas because it reliably always sprays the amount of cryogen that you have selected, and therefore there will always be consistent and adequate spatial cooling of the selected area. Whereas with the contact cooling, if you're novice or if you're doing it too fast and the skin was very warm, you may not necessarily always consistently cool the entire area. So the advantage of the DCD is that it's so selective that even if you're going at a higher hertz, that it's always going to cool every area that you are going to laser. But the contact cooling, which we have in the Evercool, is also very good because if we want to, if we have a very deep target and you want to leave it on for a little longer to get that depth of cooling a bit deeper, or if you want to use it as a compressor, for example, with some of these venous malformations or protruding venous lesions, or simply in very sensitive skin, you can use the contact cooling. So we have a great advantage of choosing 2 different cooling methods. And remember, the DCD is not just because it's the cryogen and it's very efficient, but it's very consistent when you're doing fast treatments because there's going to be no compromise. Whereas when you're doing very fast treatments with the contact cooling, sometimes you may have inconsistent areas of cooling. Remember that. So we have 2 wavelengths. We can reach the superficial vessels with the 5.5 and reach the deeper ones with the 1064. So really with the V-beam Prima, we can treat all different types of vascular lesions, whether they are superficial red, whether they are deep, whether they're blue. In the case of periocular veins, periorbital veins, we can use also the contact cooling handpiece as a compressor. So remember the advantages, which is not just 2 wavelengths, but by the way, with the 1064, we also have the microsecond wavelength, so we can do microsecond treatment, just like I explained with the GentleMax Pro. But we also have 2 methods of cooling, and the DCD has its place, certainly when you're doing fast treatments, and certainly for those who are delegating treatments where you want to be absolutely certain that the skin that's been treated has been adequately cooled. Now, the question is, what about the port wine stains? Now, we have multiple systems. A couple of lines have been missed here. Apologies for that. But why the V-beam Prima is very effective in port wine stain? We have multiple systems in terms of vascular platforms. Well, we need to understand the pathology and the histology of port wine stains. And we know that these are capillary malformations, but these are very small. And then they tend to have very short thermal relaxation time. We also know that they have a high flow and they have increased vascular endothelial growth factor, which makes coagulation of these vessels very difficult. And therefore, destruction of these vessels using a purpuric mode gives us better and more efficient results. This is why we know from experience, and there have been multiple studies with the V-beam and with other systems where if you compare purpura versus no purpura, we know that the purpuric setting is going to give us better results. So we have the advantage of going to a very short pulse duration with the pulse dye laser. We are able to go down to 0.45 milliseconds, extremely short pulse duration, extremely efficient for port wine stain in kids because the vessels have very, very small diameter. But in adults, we can go down to 1.5 millisecond because, again, remember, these capillary malformations have small vessels and the thermal relaxation time is short. Many other systems will have a longer pulse duration. So the disadvantage is you're going to have to use a higher fluence to get almost like a subpurpuric effect. And again, with the higher skin types, that could cause a problem. And even with some of the lighter skin types, there can be epidermal overheating. But that's not the whole story. So remember, the importance of port wine stain with V-beam Prima lies with the fact that we have a very short pulse duration that we can treat in a purpuric setting, which all the studies have shown that it's best. And by the way, there is one study by my colleague, Peter Bjerring from Denmark, who showed that the best pulse duration for port wine stains is 1.5 millisecond, which is what we have in the V-beam Prima. But the V-beam Prima also has a very large spot size up to 15 millimeter. And the question is whether that large spot size is going to be more beneficial for us. If we look at the biological effect by simply increasing the spot size, we know that we are getting deeper and the depth of penetration is better. This is an image with the same fluence, 10 joules per centimeter square, but look at the difference in terms of the biological response when we're using a large spot size. The energy is simply going to be more efficient because we are getting the light more deeper. So these are my patients. This is one of my patients who had multiple sessions with the previous model. And on the left-hand side, that is after several sessions, and then 2 sessions with the large spot size V-beam Prima, very nice clearance. And a dark skin type, in this case, dark skin type, again, multiple treatments before, so-called plateaued, and then moved over to the V-beam Prima with a large spot size, which meant depth of penetration. I was able to give a very nice clearance. And I published mine. This is one of the first articles on the V-beam Prima that was published. I published this in the Journal of Cosmetic Dermatology with the title that a larger spot size does enhance the penetration and the efficacy in the treatment of port wine stains. So our approach to port wine stains is now different because in the past all we had is we had to resort to a relatively small spot size, increase the fluence to get the results. But now, because the system has more power and we have a larger spot size, we are able to get deep. So we will start with a 15 or 12 millimeter spot. So we start large, so we can go deep, which also means we can safely treat darker skin types. We need lower fluences for that. And then as we treat the deeper components, we move upwards, and then we can use a slightly smaller spot size. And this is not new because one of the recent articles that was published in Lasers and Surgery and Medicine has looked at the characteristics of these resistant port wine stains to lasers and found that in addition to the vessel size and the high blood flow, and by the way, the high blood flow is the reason why it's difficult to coagulate these vessels, because there's never enough time for the heat to adequately build up to get good coagulation, because it's a moving target. But one of the key main reasons was majority of depth of vessels. And this is why having the V-beam Prima with a 15mm spot allows us to go deep. And the other advantage, remember, is that we have a very short pulse duration that we can get into a purpuric mode, which matches the short thermal relaxation time of these malformed capillaries. And I thank you all for listening. And now it's time to answer your questions.
Thank you very much, Firas. Very informative as ever. We have a couple of questions for you. First of all, how should I manage a non-responsive facial hypertrichosis? And the question is asking, would you use alexandrite to treat this?
Which skin type?
Doesn't say.
I mean, obviously, regardless of the condition, the laser is going to target the hair. So hypertrichosis, if it's if it's in a lighter skin type, then of course the alexandrite will work better. So if you're talking about a skin type 1 to 3, and you have the choice of both wavelengths, then the 755 is going to work better. And then you can use a shorter pulse duration. And the other thing is, if it's facial hirsutism, if it's associated with polycystic ovarian syndrome, then you can combine that with topical eflornithine, such as Vanicare. So the choice would be, if it's a lighter skin type, 755 with a shorter pulse duration. I can also see a couple of questions. So why do I stop the DCD on the V-beam for warts? For epidermal burn or the verruca? That's a very good question. So the reason why we switch off the cooling when we are treating warts is basically the wart is an epidermal lesion. So we want to, on purpose, get a destruction to the epidermis. This is why we don't use cooling, because if we are using cooling, we are in a way wasting some of that fluence, and we are not going to get a desirable result. You can read my article in Dermatologic Surgery on pulse dye laser and warts that was published in 2016. And basically all the studies that compared cooling versus no cooling showed superiority when the cooling is switched off. So when you are treating warts, you need to switch off the cooling, because otherwise it will decrease the success chance, because we want to, in this case, have that epidermal destruction. And then another question is about the settings for acne scar with a peak away. Okay, so the settings, I tend to use high end of settings because that's where as I showed you from my published study, you get more LIOBs, more collagen replacement. So I typically will start from 1.7, 1.9, that would be where I would start, and then I would increase incrementally. So if I'm starting with 1.9, then the subsequent treatment will be 2.1, then we'll go to 2.3, and obviously observe the downtime, the response, but I tend to start at the higher end of the 1.9, sometimes even with 2.1. And then I can see another question.
I think it was following up on the hypertrichosis. It was skin type 3.
So I would use the alexandrite, and I would use the short pulse duration. How many joule? I can't see the other question. Is there another? How should I manage a non? Yeah, okay, that's a far. Okay, any other questions, Hamish?
Those are the only ones I can see at the moment. I did answer a couple of the others for you as we were going through, Firas.
Okay. Well, we still have 5 minutes, so if anyone has a question, we still have 5 minutes. We sometimes the questions may take a slight delay before they appear. On tattoos with peak away, what I wanted to add as well is that there are, again, different ways of doing them. So these are the wavelengths that we use. So once again, the 532 is what we use typically for red, orange, and yellow tattoos. The 730, 785 for the blue and green tattoos, and the 1064 for black. But as we progress with treatments, and then if the response is slow, so one of the other things you could do is combine it with the core. So you do a pass with the core, that is deep mode. 5% is fine, is enough. You don't need a high density, and something like 40, 50 millijoule, really, again, not that high, to just create these fenestrations in the skin, and then do the pass with the zoom handpiece. And what that will do, it will again give us the advantage of transepidermal elimination of the ink tattoo. So the first thing to do is to do your single pass with a zoom, look for the end point, which is the frosting. That's the first thing you do. But in some of the resistant cases of tattoos, the other thing you can do is combine that with the core. So that's the deep mode, 5%, a single pass, followed immediately the same day, immediately afterwards with the zoom. And in the very resistant cases, you can do 2 passes with the zoom. So that's the first pass with the core deep, then a pass with a zoom, cool the skin, 20 minutes. So it's almost like the modified R20 method that was published many years ago. And then after 20 minutes of cooling, after the first pass with a zoom, do a second pass with the zoom. If it's a resistant black tattoo, then if you have done all of this, the other thing you can do is you can shift the wavelength, because remember, black absorbs all colors. So you can do the core followed by the 1064, cool the skin, and then do another pass with the 532. That is for a resistant black tattoo. And again, I think this is one of the questions that's frequently been asked. So I thought I would address that now. I think there is a new question, Hamish. I can't see it, but it's popping up.
It's a good question, which doesn't have a very quick answer. It's basically what pulsation for leg veins with the YAG on the Gentle Max Pro. Okay, I will make it simple.
Yeah, I mean, that is true, but I will make it simple. If it's red, you're looking at 10 to 20 milliseconds. So basically, you start with a 20. If it's very, very small, you may even need to go as short as the 10 milliseconds. So if it's red, they tend to be thin, small, and superficial, so a 10 and 20 millisecond. If they are more purple, bluish, then you are in the region of 30 millisecond at least. And then for the green ones, 40, 50, 60 milliseconds. So whilst it's always difficult to give the exact setting, but as a general rule, if it's a very small, thin red vessel and you're using a 40 millisecond, that's too long. And if it's a green reticular vein and you're using 10 millisecond, that's too short. So remember, reds 10 to 20, blue, purple around 30, and if it's green, just start with a 40. Any other questions, Hamish?
No, nothing there. Perfect timing, because we are now at 1 hour.
Yes, brilliant. I can see that.
Okay, well, thank you very much once again, Firas, for that really interesting presentation. And also thank you to everybody that has dialed in this afternoon. And I hope you all found that really useful. Okay, so now we will finish the webinar. And once again, thank you very much.
Thank you, Hamish. Bye.